You're listening to All the Pieces, a podcast created to keep you informed. Now here's your host, Chief Quality Officer, Dr. Karan Mohan.
Hello and welcome to another episode of All the Pieces. I'm your host, Dr. Karan Mohan. Bispecific T-cell engager, or BiTE. No, it's not another video game that your teenager is playing or an aggressive dog that you just got from the shelter. It is a new, specific form of cancer treatment. BiTE therapy directs your immune cells, known as T cells, to find and attack the cancer cells. T cells typically need help to identify cancer cells, and those cells and the cancers are very good at hiding from your immune system. BiTE therapy uses what they call an engager. Think of it like a lasso that attaches one to the T cells, another end to the cancer cells, and builds a bridge to help get in close proximity to each other so the T cells can attack the cancer cells. This is a brand new therapy that is revolutionizing cancer treatment for very specific types of aggressive cancers. And today, to talk about it, I have two very special guests with me, Dana McDaniel and Sherry Lehman. This is a huge topic, isn't it?
Yes, it is. It's something that we're going to be able to offer here to our patients at Mosaic that we haven't offered before, and so we're really excited about that. What
makes BiTE different from other treatments, Dana?
So it gives the patient another option, essentially. It's a new form of immunotherapy, and it just works a little bit different from your traditional chemotherapy. So it gives patients just another tool in their toolbox to be able to receive to increase their lifespan and improve their outcomes.
Excellent. And is this a newer technology, or has this been around for a while?
It's been around since 2014, and actually it started as a drug that was indicated for ALL. And those patients have been receiving that since 2014, but those are happening in large transplant centers. So it just became available for solid tumors, which is where we find the landscape that it's going to be utilized. So these patients that have solid tumors, it gives them another option, namely small cell lung cancer, which has limited options already. So to be able to have an additional thing for these patients to receive, it really will improve their care.
And small cell lung cancer is a pretty aggressive cancer.
It is. It's very aggressive. Patients, their life expectancy is 13 to 18 months.
Wow.
And one of the new drugs that came out has some really good data. This is practice-changing information, and these people, it could extend their life up to 10 months.
Wow.
And I know that doesn't sound like a lot, but when you're talking of a limited lifespan for small cell anyway, that's another Christmas for these patients. It's another birthday, another milestone, so that they can have that time to spend with their family.
Yeah, 10 months seems like nothing, but to a patient who has only a few months to live, it's life-changing.
Yes, absolutely.
Sherry, I'm going to turn the attention to you for a second. How does this BiTE therapy compare to other treatments, and what sets it apart?
Well, I think what sets it apart most is just the novel way of introducing something new. We have chemotherapy, and that kills cells. It doesn't differentiate good cells from bad. This type of sophisticated technology now is being so targeted, where we're bringing in the T cell, which is that component of your immune system, and linking it right to the tumor cell, so it's more of a direct hit. And so it's groundbreaking as far as I'm concerned in how we're going to treat these patients.
Yeah, and the way I understand it is it builds that bridge. It's an engager, right? So it engages the killer cell, if you will, the T cell, to engage with the cancer cell,
right,
without hurting the good cells, if you will, the
right,
healthier cells.
Right.
And who is a candidate, Sherry, for BiTE therapy?
Right. We're looking, obviously, Dana had mentioned the small cell population.
Of lung cancers.
Of lung cancer, the multiple myelomas. There's a couple of different medicines are going to be available for that. And then the non-Hodgkin's lymphoma, the follicular and the diffuse large B-cell lymphomas are the ones that we're looking at to get started.
Excellent. So it has a pretty broad range of what it can target. Sherry, another question for you is, can you explain what a typical BiTE treatment looks like? Is it a series of shots? Is it a patch? Is it a... What is it?
Right. There's a couple of different ways of giving them. Two of the multiple myeloma drugs are actually given in a subcutaneous injection in their abdomen. And then...
kind of like insulin or
Yes.
Ozempic?
Yes, absolutely. And then the others are infused through the vein. There's some step-up dosing that's going to be required, meaning we give a fraction of the dose, to introduce these medicines slowly into their systems, because we know that there can be some side effects of the cytokine release syndrome or some neurological issues. And so, they get admitted to the hospital, and then they'll be kept in the hospital afterwards for observation for these. And, they all are specific as to when they can shoot off some of these side effects. And so we want to be able to safely, administer these drugs and have good outcomes for the patient. We have a committee, and this committee has delved into making sure that we have a checklist. Even though the doctor says that the patient is ready for it, we want to make sure that all the checks are done. Are they cognitively able to take the medicine? Do they live within an hour's distance of the facility? Do they have reliable transportation? Things like that will not only add to making sure that the patients are safely taken care of.
You mentioned something very specific, which is the cytokine release syndrome. It's a pretty serious condition that can happen as a side effect to this.
Yes, sir.
What is that?
Well, it's an inflammation that goes on when the antibody and the T cell, the proteins mix. It's a delayed reaction. It can be hypoxia, it can be fever, chills, and there's different grades of the specific event. Grade 1 would just be fever, and then it can go all the way to, SATs falling and hypoxia and intubation. And so these are all things that we'll have to be prepared for to monitor for these patients.
And Dana, what has the research shown? How many patients might have something like a side effect like this?
So obviously what Sherry's explaining is extremely, frightening, because these are big things that can happen. We see a lot of grade 1 and 2, which means the lesser side effects, and the grade 3 and 4 are the ones that, like Sherry's describing, that would require intubation or more therapy. It's a smaller amount, and it's drug dependent. So one of the drugs, maybe a grade 3 or 4, we're looking at 2% likelihood of these things occurring.
So 2 out of 100 people could potentially have
right. And early identification is key. So that's something that we're making sure that everybody's educated on, so that they understand what those early indicators are and decrease the likelihood of progression.
Yeah, and this is one of those risk versus benefits type of discussion. For a deadly cancer, if the treatment is working, extending your lifespan, 2% chance, that's a discussion worth having with the provider.
Absolutely.
So when would this therapy be available, Dana, at Mosaic?
So we've slated for April 14th for our go live. And a lot has had to occur before that can, that date can happen. I think I know there were easily over 100 tasks that we had to accomplish to get this to be, like Sherry mentioned, safe to be able to, provide for our patients.
Absolutely. And what are some of those implementation things that need to happen prior to it go live?
So a lot of collaboration. We've had a team dedicated to this since October of last year, and we've been meeting bi-weekly and then most recently weekly, and then just reaching out to all of the departments that may be impacted. So we spoke with a hospitalist group yesterday to just go over the things that they may see that they're not used to seeing from these drugs, the CRS, the ICANS, and then how to treat those types of disorders. They remember how to do that. They just haven't seen it for a while.
Refresher course, if
yes,
you will.
Absolutely.
What are ICANS? Sorry to interrupt.
ICANS, it's a neurotoxicity that occurs because of the immune system. And so that presents, the patient may present to the ED, they may present to urgent care or their primary care, and maybe have a little confusion or lethargy. And for those providers to be able to identify that that's a potential ICANS, that's why we're trying to get the word out, is so that people understand those types of symptoms and what that could progress to if it's not identified early.
Right. So it's a new therapy. It has some side effects within reason. So recognizing that this is a side effect of this BiTE therapy is a big educational push throughout the system.
Yes, and when we think of educational, it's not just to our system, it's to the EMS, it's to our surrounding hospitals, because our patients may present there, informing the Cameron Hospital and the Atchison Hospital and anywhere that they may go in the community. It's really important to make sure that they are aware. If the EMS gets called to their home, make sure that that's something that they're aware of. And so we've done a couple of things to try to help get that communication out. We developed a wallet card for the patient so that it tells it's a small business sized wallet card, but if they keep that on their body and then they provide that to the person that they're interacting with, then that will help them identify if they're on a bispecific antibody therapy. And then we've also worked with our IT and work with our Epic analyst to create a BPA that way when a provider opens up their chart, they will see, it will display to them that this patient's on a BiTE therapy, and they may or may not know what that is or remember what that is, but it gives them some information that I need to look a little bit further to see if whatever this patient's exhibiting could be because of their BiTE therapy.
So there'll be a lot of alerts within the electronic medical record to let the providers know,
Yes.
hey, they're on this very specific type of therapy. Look out for these CRS or ICANS, which is a neurological.
Yes.
Excellent. Sherry, anything else in terms of education that's being rolled out? Sounds like there's a lot of, there's a therapy and then there's education, which are equally important.
Absolutely. Obviously the patients are going to be well informed before they ever sign a consent. But, as nurses, we want to make sure that the nurses in the organization are familiar, and we plan on visiting nursing units. We think that the ICU, the ED, step down, and obviously the oncology floor where these patients will be. And so we plan on, that's getting set up now. We'll go to unit meetings or whatever and provide information so, people aren't just blindsided.
Right. Just because it's new, the education piece is going to be equally important.
Right.
So, and I did see Dr. AJ and Dana at the hospice meeting not too long ago, so I appreciate the education that's being rolled out, because that's a big service line that can help support these patients. Well, there you have it, folks. Bispecific T-cell engager is a new cancer treatment for very specific types of cancers, but it seems like the technology is going to expand to other forms of cancer as well. We're planning to go live with it
April 14th.
April 14th. If you have any questions about what it is or who to ask, what it means for the patient, there'll be a link provided, or you can reach out to Dana McDaniel. I'm volunteering you for this one, Dana.
Yes, that's okay.
Or Sherry Lehman, who can give you a little bit more information about BiTE therapy. And this is truly about expanding the care and our services for our patients. Cancer is a debilitating disease. It can rob you of time, and this therapy will give you some of that time back. And there you have it, folks. Until next time, take care, brush your hair.